Some of the risks that are unique to forehead surgery are, as we mentioned before, hair loss. Now there's two different types of hair loss that can occur with a hairline advancement or with a big forehead surgery. The first is alopecia, or hair loss at the site of the scar. Now this is what we are trying to avoid. This is a risk of the surgery, is that something from the surgery damages the hair follicles and the follicles don't grow back. That's a risk we're trying to avoid. And that's what we talked about previously, where we can do grafts or scar excision to help improve that appearance. The other thing that's not so much a risk, but almost all patients experience, is a little bit of shock loss. And now what this is not one area where a lot of the hair falls out, but just kind of thinning all over the top of the head. And now patients won't notice one big bald spot, but what you might notice is a little bit more hair in the brush when you brush your hair, a little bit more hair in the shower drain when you wash your hair. And what that is a temporary loss of hair that will grow back. And so what shock loss is it's actually called telogen effluvium. So all the time we have hairs that are growing, we have some hairs that are in active growing phase, some that are in resting phase, some that are sleeping. When they're in the sleeping phase, they tend to fall out. So we always have hairs in that cycle. When there is a change in blood supply, more of the hairs go into the sleeping phase. And so you may notice that more of them are falling out. The good news about that is that those hair follicles are still preserved, they're still alive, and so they will grow new hairs. That hair does grow back, but you just need to kind of bear with the process for a little while as you notice a little bit more hair shedding. This is also something that the platelet-rich plasma treatments that we do afterwards can help to minimize. The PRP helps boost hair growth and helps those new hairs to grow in faster. Other risks that come with the surgery, there's always a risk anytime we're doing bony surgery that the bones don't heal. Now, I have never seen this from a surgical patient. The only time I have seen problems with bone healing is really more in trauma, where it's not a precise cut, but it is always a risk. The big and scary risk is weakness of one of the forehead muscles. Now, there is a branch of the facial nerve, the one that controls your forehead muscles, that runs right in this area where we're doing the brow lift. Now, I know where that nerve lives. I know how to avoid it. It's pretty unlikely that it would be completely transected, but there is no guarantees in surgery, and that is always a risk. What I have seen happen more often is that nerve becomes a little bit weak temporarily, which can last weeks to months. And I think that this is also rare, but the few times that I have seen this, it's been temporary, and I think the nerve is not cut, but maybe just got a little heated from some cautery or stretched a little bit from retraction. And so the eyebrows end up a little bit asymmetric because the nerve is not working as well as it should be. Good news about this is that time heals it, it fixes itself, and everything goes back to normal. Other risk after a brow lift or after a forehead surgery is that the brows may be a little bit asymmetric. Now, I try to point out in pre-op that everyone's brows are asymmetric at baseline. So everyone has one brow that's a little bit higher than the other, and that's because the two sides of the face grow up as sisters, not twins. So no one has a perfectly symmetric face. So if one side of your forehead has slightly more muscle development and is a little bit stronger, it's gonna move that brow differently than the other brow. Now, in surgery, if there's one that's obviously higher than the other, I can make an effort to try to pull that one a little bit more and to make them more symmetric, but they'll be more symmetric at rest. If you have one muscle that's stronger, it will still pull up on that eyebrow more, and so you may still notice a slight asymmetry. It's never gonna be perfect, and that's something that patients, once we explain that pre-op, they tend to understand and realize it's no big deal. But if I don't explain that initially, sometimes then people are looking in the mirror afterwards, and then they start to notice things that were probably there all along, but become more of a focal point after surgery. So that's basically the big risks with forehead surgery. There's certainly a few other things that are on our sheet, but those things are super unlikely and worth reading, but probably not worth losing any sleep over.